COVID response.
Recently, the magazine El Conquistador, it's a local Hispanic newspaper, went ahead and ran an article, and I believe it was from the Medical College of Wisconsin. And they went ahead and put some pretty not so good things that I didn't like in the newspaper. They went ahead and said that the CDC went ahead and okayed the COVID shots, that all the studies were done. When I saw the video, I heard doctors saying that no, in fact, that it was inconclusive. They only used people that never had COVID to go ahead and test it. So I heard the doctors say that. Then they're saying that there's no issues with the shots. It's not a vaccine, it's with the shots. And the kids 5 to 11 need to get it because they're going to the hospitals at a high amount of rates. And I believe somebody here reached out to Conquistador to come over here to go ahead and give our side of the story, saying that, you know, there hasn't been studies that is adequate, and I don't want my kids to get forced to have the shots because it's not a vaccine, it's a shot. And there's other remedies out there. I know there is because they're using them in Mexico, they're using them in Peru, they're using them all over the country. And if they're gonna force my kids to get it in order for them to go to school, that's gonna be an issue for me. You know, I would have to homeschool them, but yeah.
Well, I would say, I think the biggest mistake we made from the health agencies and our medical establishment was not focusing on early treatment. And here we are, 2 years into the pandemic, and NIH guideline continues to be, if you get tested and you test positive for COVID, go home, afraid, isolate yourself, and virtually do nothing. Tylenol, I mean, they had monoclonal antibodies for a while, and try and get them. You know, the coronavirus has mutated, and you know, the old monoclonal antibodies, kind of like the vaccine, was targeted more toward the original non-mutated virus. My point has always been, get more information. There is so much, even today, that we don't know about the coronavirus. There's so much we don't know about COVID, the disease. There's so much we don't know about the COVID vaccines. And when you don't know a lot or everything, exercise some caution. Now, there's a lot more we know today than we knew at the start of the pandemic, and we're not applying those. We're just not applying that information. And I think what's been most troubling to me is, in addition to the deaths that I don't think had to occur, because I'm thoroughly convinced that early treatment works, with it's a cornucopia of cheap, generic, repurposed drugs with incredible safety profiles. And they work. I've referred enough people to doctors. I follow up. I'm talking to them all the time. Some just miraculous turnarounds. And yet we just ignore that. And you scratch your head and go, why? Why would we ignore that? Why are we only focusing on the very expensive, patentable drugs by Big Pharma, and we're just ignoring all the generic ones? I think it's kind of obvious, but it's been a real shame. And in addition to what we've done to our children, you know, I'm sorry, you know, just one quick talk, masks on children. Even theoretically, and there's not many studies that show that masks are really particularly effective, not for this kind of respiratory virus, which permeates just about everything but an N95 mask. Have you ever watched kids wear masks? So why do we maintain this fiction? Why the charade? I mean, let's let kids be kids. Let's watch them. Who else saw that video of Las Vegas?
Yeah.
Did you see? Yeah. You know, that was called Joy Celebrating Freedom. Okay, so June, go ahead.